Cholera in Zimbabwe, Problems and Preventions, and How We Can Help by the Sun Bear Group. Which brings us to the biological information about the vector-borne illness cholera. Cholera is caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae in the strains O1 or O139. Exposed patients typically present symptoms between 12 hours and 5 days following initial exposure, with the main life-threatening symptoms being acute watery diarrhea, which often leads to severe, deadly dehydration. The bacteria can be combated with strict antibiotic regimens, which must be followed in its entirety to prevent the likelihood of the disease adapting antibiotic resistance. Following the typical antibiotic treatment, majority of cases can be treated successfully through prompt treatment of oral rehydration solution, which combats the severe dehydration that threatens the lives of thousands. Our group decided to focus our efforts to treat cholera outbreaks in the world by focusing on the African country of Zimbabwe. As of a 2019 census, the country was populated with approximately 14.65 million people and separated into 8 provinces. The urban province of Harare is the capital of Zimbabwe, located in the northeastern part of the country. The political environment of Zimbabwe is complicated. The government is very corrupt, relying on lies and empty promises to secure re-election into power, which causes severe problems with infrastructure throughout the country, specifically in urban settings, and problems with dispersing funding. This means that areas like the Harare province lack the funding necessary to update and upkeep sanitation infrastructure, risking the health and lives of its citizens. So why focus on Zimbabwe? Zimbabwe is one of these countries who bear the risk of outbreaks of vector-borne illnesses. It is currently the 6th poorest country in the world, with a suffering economy, poor government surveillance due to corruption, frequent and significant outbreaks of disease, and a more recent presence of a mutated antibiotic-resistant strain of V. cholerae.
Between 2018 and 2019, the worst outbreak of cholera occurred in Zimbabwe. There were over 10,730 cases of cholera in Zimbabwe and about 69 deaths. Public gatherings were banned in the country due to the state of emergency that was declared from the government. Of these confirmed cases, there was 65% that showed evidence that there was a Vibrio cholera O1 serotype agua isolates that were multi-drug resistant. This meant that there was an unexpected high-level resistance to the antibiotic treatment of cholera. So why are we looking at Harare specifically? Harare is Zimbabwe's largest city. Thousands of Harare inhabitants who used to work in both formal and informal sectors have lost their livelihoods as a result of the economic meltdown experienced in the past 2 decades in Zimbabwe. The majority of the people in both formal and informal settlements have limited access to adequate housing, food, healthcare, and other necessities. Urban poverty will be firstly understood as failure by the people in Harare to access developed land, adequate food, healthcare, and other necessities. Here is a map that shows the certain areas where the outbreaks were worse than others. Notice how Harare had the worst amount of cases within the country.
Our strategy stems from the idea that low-income countries need support. Hyperinflation has led to a sharp increase in medical costs, making it harder for the urban poor to access healthcare. Also, supporting general health and well-being in general of all nations is critical to economic, political, and overall success. It's important to build up low-income nations, and doing this will help the world progress as a whole. Overall, we need to fight for health equity for all. Now, for our strategy to help Zimbabwe in particular, we want to focus first on the long-term solution for cholera, which lies in economic development and universal access to safe drinking water and adequate sanitation. We can achieve these goals by helping the people of Zimbabwe adapt long-term sustainable wash prevention tips, which include drinking and using safe water, washing your hands often, cooking food well, and also keeping it covered. Also, consider getting vaccinated against cholera, and finally, cleaning up all the time while you're in the kitchen. Also, to help Zimbabwe, we want to partner with Sanergy to help further our goals. It's also important to note that this is actually feasible and our plan will work. And we believe this will work because we can help provide a piece of structural resilience for citizens and give them a new outlook on a healthier lifestyle with less cholera. We also looked into the fact that if Zimbabwe was willing to receive international aid, because this is what we want to give them, and we found that the USA has already requested $139,500,000 in aid for the fiscal year of 2021. We also want to use a pilot test to determine true need and or want for the intervention among community members. But knowing that the USA has already pledged aid, we know that Zimbabwe is willing to accept international help. We also know that organizations such as UNICEF already partially funded cholera projects in Zimbabwe, which again proves that aid from abroad is welcome. Now we want to give a quick overview on Sanergy. Sanergy is an organization that has created a full value chain approach to addressing the sanitation crisis, offering a sustainable solution for urban slums. Sanergy is unique where they convert the waste into organic fertilizer and insect-based animal feed from the latrines that they service. Our partnership with Sanergy is beneficial to all parties involved because since we share the same values and goals, we can work together to integrate all that they have done in the Harare region in Zimbabwe. Now for a quick cost overview, Sanergy's model costs $26 per person per year, compared to sewers which cost at least $56 per person per year. Of this $26, half will be covered by market forces, significantly reducing the cost to governments to provide these services. Also, for the latrines themselves, those cost $590 per unit. This charge covers business support, marketing, branding, training, and daily waste collection services. After the first year, there is also a $106 annual fee. Overall, our impact in the first year will be significant. By installing 10 toilets at a cost of $590 each, that will cost $5,900 for the first year to install the toilets of our $50,000 total budget. With the remaining budget at a cost of $26 per person, we can serve almost 1,700 people for 1 year. We also do not include labor costs in this calculation. We will rely on the help of volunteers already in the area and the volunteers that Sanergy can provide.
We will continue to speak out to communities at home and abroad about the possibility of reducing cholera infections in Zimbabwe. Our hope is to increase attention from major donors to fund our project after the initial year. Communication is especially important to bring this worthy cause to light, and we'll promote our goal on social media to encourage more research.
Zimbabwe spends more than 80% of its revenue on civil servants' salaries, leaving little left over for much else. The Bank of Zimbabwe estimates that the country needs to invest $26 billion over a period of 10 years to upgrade its infrastructure, but they don't have the money for this and are unable to borrow it from anywhere else. Businesses and churches have tried to help by paying for water deliveries, buckets, and water treatment tablets. But without a long-term plan, financial investment, and above all, political will, this preventable disease will return again and again to claim more and more victims. We will continue to be involved with our friends at Sanergy to track our progress with the installation of the latrines. We will administer monthly surveys to collect what the community thinks about the newly installed latrines, what they like about them, and what we can do to improve them. Our team will administer quarterly meetings with Sanergy team in Zimbabwe to get hands-on experience and progress reports.
For connection to this class, we've talked about primary prevention techniques, health equity, structural resilience, and our project is to ethically implement sustainable change in the Harare region of Zimbabwe. Our end goals are to fight the cholera outbreaks in the Harare region of Zimbabwe by providing fresh life latrines on 10 different crowded corners around the city. We also want to give Zimbabwe a chance to improve economically, raise the quality of life for all, and improve health equity.